So we're really proud of the work that we do at Affirm. We see over 33,000 clients, unique clients every year. We are in 11 of the 15 counties, and those 11 counties are at least 95% of the population in the state.
There's lots of programs that we run. So we have Title X, we have a grant that's the STI project, and we also have a program called ACM, which is Adolescent Champion Model.
Working with Affirm on the Adolescent Champion Model has really changed the way we do healthcare for adolescents. And it's given us tools and training on how to work with the adolescent, how to work with the families, how to really transition that person into adulthood. An exciting program that we also partner with Affirm on is the Understanding Me program with Special Olympics. Students who are 18 to 21, some of them have never had a discussion about what does it mean to have a relationship. What is sexuality? What does that mean? What does that look like? What does that feel like? And we're able to share it as a group and talk about it because it's a safe place. And it's probably one of the highlights of my day, and it's been such an awesome program.
It's not just caring for the patients, it's also caring for those providers. And by that I mean training them to be able to be the best kind of provider they can be in this arena.
The probably greatest demographic that we would see would be female patients aged 24 to 45. But we also do a lot of mobile services. So we go to the downtown YMCA and we're serving a lot of adolescent clients, do a lot of outreach with older adults that are experiencing homelessness, and we're testing them for syphilis. And so it's a really broad, diverse group of patients that we're able to impact with this program.
We are in the business of breaking down barriers and trying to find populations that are hard to reach, hard to serve. Affirm has been a critical partner in that aspect of what we do. Without them, there are many, many more people we would not be able to serve, many more services we would not be able to extend, many more tests we would not be able to offer, particularly in prevention. I just can't imagine what we would be like had we not had Affirm's support thus far, and certainly can't imagine a world in which we would have to go without it.
Seeing the changes when we bring in different clinics to work with us and provide services. The mobile units that are reaching rural areas and people that might not get to come in, or the standalone clinics that are offering, unhoused people services, just to see the compassion and the care that everyone involved with Affirm offers. I'm very proud of that.
So NIFRA is our acronym. We are a membership organization, and Affirm is one of our members. Affirm is definitely making an impact. When we partnered with them to provide a health equity grant, they dedicated themselves to look at and reach out to community partnerships. One of the projects that they're working on is a data-driven project working with Black, Indigenous, and other people of color, and making sure we can bridge the gap in the Phoenix area.
I think Affirm and its network of providers and the public that Affirm serves, right, is going through a really challenging time just because of how the political landscape has become increasingly more hostile towards sexual and reproductive health care. How does it still serve its mission when it's undergoing all of these attacks?
I think Affirm plays a unique role and a critical role. Being a nonprofit organization, we're a little more nimble. We can respond a little more quickly to changes. That coupled with our strong infrastructure that we've built over 50 years of being a trusted partner with networks helps us really respond to the needs of Arizonans.
Well, congratulations to Affirm on 50 years of wonderful service. Being here for 50 years does show that the community needs you, the community supports you.
Although we do receive federal funding to provide services, one of the things that is really crucial and that we are always in need of is private funding and funding from corporations and other organizations so that we can advocate for the various needs of reproductive health.
So we're looking for donations to continue our advocacy work. And that's just a really important role in Arizona. There's not a ton of organizations that are focused on sexual and reproductive health care, in particular contraception. And so that's always my goal. How can we make the pie bigger so that we can provide more services? And I think in the next 50 years, there will be more opportunity for us to do that.